So good afternoon to everybody. Thanks for the invitation. Yes, the background of my presentation is represented in this slide. So which is the difference between open surgery and minimal invasive surgery? This is what is indicated in the slide. So in open surgery, you have a direct access to the human body, thanks to a large wound, a large cut in the body, in the chest, in the abdomen, and you enter with your tools, traditional tools, and with a direct vision and with a natural hand-eye coordination. When you have minimal invasive surgery, that nowadays is something quite, let's say, traditional, natural for many surgical operations, you have to do all the same task by using small holes inside the abdomen or inside the chest, and so your tools are not simple short tools as a pen, but they are long tools. You need to put your eyes inside by using endoscope, so everything is a little bit more complicated. On the other hand, this is the main methodology used nowadays for doing surgery for a number of reasons. First of all, the incisions that are smaller, but incision smaller means that you have also less complication in terms of blood that you are losing during the operation. So you reduce the pain, the discomfort, also in terms of, in terms of healthcare cost. You are introducing back your patient in the normal life with less cost for the overall society and for the labor market. You have faster recovery time, and also in some cases, if you have the good tools, the good helpers, enhanced surgical precision. But which is the drawback? The drawback is that you lost dexterity. Try to think about to do a knot without looking directly to your hands, doing a knot, and not using simple fingers, but using very long, straight instrumentation with a limited dexterity in the wrist, in the shoulder, and the elbow. And so this means that you need a huge experience to do this. You need a long training, and long training is something that has a cost, because you have to train surgeons without doing real operation, but just for the improvement of abilities. So, and this is the reason why robotics was introduced in minimal invasive surgery, because thanks to robotics, you can improve the precision, the accuracy of any task. You can make your task more reliable. You can obtain more standardization, let's say. You can also help to make some procedure that in open surgery are quite straightforward, but with the minimal invasive approach, they are really complicated, and you should use robotics to do that operation in a more, let's say, familiar and easy way. You can integrate, I put there AI, but let's say I can integrate intelligence, I can integrate image, I can use images for doing an image-guided surgery. And this is another point, the last one, remote surgery, that maybe it's not the most relevant now for some issues related more to the responsibility of the surgeon. But if you think about the first robot developed for robotic surgery, they have been developed for the battlefield to make possible the operation in a different setting of the surgeon. And we can say that now it's the area of robotic surgery where robot can really improve dexterity. In the picture, there is the Da Vinci robot that is, let's say, the most relevant robot used for surgery nowadays. With this robot, you can reduce very much the learning curve to learn how to do minimal invasive surgery. And most importantly, you can reduce the trauma. And for in consideration of the success of this type of operation performed thanks to the help of robots, nowadays the market is very variegated, the market of robotic surgery. I have to say that for about 15 years, there was just one player in the market. It was the Intuitive Surgical and Da Vinci, and the reason was a patent reason. So they had all the main patent for the articulation of the wrist inside the body. But after the expiration, let's say, of the patent, nowadays there are many players from Medtronic, the system called the Hugo. So again, the approach is the same. You have multiple arms entering into the body, and the surgeon that is helped in terms of ergonomics and visualization in 3D thanks to specific interfaces. Or the Senance system. It is a system developed now in USA, but originally it was nurtured in a company, in a pharmaceutical company in Milano so far. And the Versus system for CMRR, surgical, all these systems let's say, minimal differences in terms of also operating setup, but the main approach is the same for all of them: ergonomics, 3D vision, and dexterity inside the body. And the last example is a system developed here in Tuscany, in Pisa, from a company called MMI, and this is again a system for teleoperation, for microarticulation, microsuturing, and so on. In this variegated state-of-the-art, our approach in our team in Scuola Superiore Sant'Anna was to focus mainly not on ergonomics or vision, but mainly on reducing the evasiveness, augmenting the dexterity at the distal part, augmenting the dexterity inside the body. So for going from a system like that, an architecture like that, to an architecture like that, where the holes are minimized in terms of size, in terms of number, and you try to deploy degrees of freedom and the instrument inside the body. And this was a sort of a fil rouge in the development of our systems. I have reported here 3 examples coming from the state of the art. The first example is a bimanual robot. The name was Sprint, single-port modular robot for surgery. In this case, you enter the body through a hole, let's say a trocar from the umbilicus with a diameter that is about 2 centimeters, and you deploy up to 14 degrees of freedom inside the body under stereo vision. Another example that is a little bit more science fiction was to make a step forward, not using an incision that you make on the body, even if the navel, the umbilicus, is a sort of natural incision, but using natural orifices, such as the esophagus, to make incision just inside the body and to deploy instrument in the stomach or in the abdomen, with the help of micromotors for small articulation and also magnetic field for reducing wiring problems. Or a system like that, this is a robot developed also with Fondazione Toscana Gabriele Monasterio for the surgery of the earth, for their repairing, let's say, some valve in the earth. In this case, this is a cable-actuated system with the ability, respect to the other counterparts, to enter between a couple of ribs, and so to make possible some minimal invasive surgery in situations where normally you have no tools, no technologies for doing the same with minimal incision. This is a combination of movies where we see also the difficulties in visualizing the area of the earth. So we are using 3 different cameras in order to focus the annulus where you have to deliver your valve. Okay, in this framework of trying to increase the dexterity, to introduce in the human body more degrees of freedom, and to avoid the wires or cable and so on, we are also developing our dream platform in the project THE for the WP1. The robot is called, the platform is called MagSoft. So, which is the idea? The idea is, again, improve dexterity, reduce the learning curve, reduce trauma. So, the same objective for all the system for minimal invasive surgery based on robots, but with different technologies. So we try to use soft materials, flexible structure, and magnetic coupling. Okay, so this is a very basic sketch of our flexible untethered, magnetically anchored platform for minimal invasive surgery. So the idea is that you have a you have a small aperture. Sorry, you have a small aperture in the human body, and from this small aperture you can deploy your module. First of all, this one, a sort of small pulley that is fabricated with a magnet and a set of modules. Then you can anchor by using an external magnetic field this module quite freely inside the abdomen. Then you can make your operation. Maybe it's something a little bit far away in terms of overall objective, but okay, we have also a brilliant team of PhD students, so we try to do something in this direction. So there are two main components: a magnetically anchored solution and the flexible untethered soft manipulator. And this is the, let's say, the sequence from the insertion to the assembly of the robot inside the body, the use, the disassembly, and the removal. And I have put here a couple of movies just representing how you can assemble inside the body the system by pulling some cables that are activated by magnetic field. I will explain later the principle. And finally, bending for the normal use inside the body, grasping, traction, and so on. So this system has basically four components. The first component is the magnetically actuated base. And this is the main principle behind the magnetic anchored actuated base. We have an external handle with a magnetic pulley and an internal module that is introduced with some flaps that are closed. Then you open the flap and you anchor your system. And when you anchor your system, you generate a sort of magnetic pulley. And so by rotating the external magnet, you can rotate the internal one, and you can, for example, retract some cables. The second part is the gripper. You enter in the body to do something. So we are developing an origami structure gripper that in the closed configuration is like that. So you can enter with a small diameter with your leg, let's say, along the body. And then you can deploy as an origami to obtain this configuration and to have the possibility of manipulation. And the third part is the arm. So the arm is again a sort of origami structure in order to reduce the weight, to improve the flexibility. And for the actuation, it can be cable-driven, as you have seen in the previous movies, where thanks to the magnetic pulley, we can make the cables shorter or longer. And we are also considering something really soft with a special design, a special origami design and based on fluidic chambers. That could help even more in terms of flexibility during the insertion. Everything has to be controlled, and as you can imagine, with all this flexible material, all these magnetic forces that are changing also depending on distance, this is not easy. So we are having parallel an activity for controlling in position. So yes, my 15 minutes have gone, so I want just to close with this last summary of all the different components. Again, we are in the middle of our research path, so we have a very clear direction that is being really minimal invasive, really safe, and really controllable. But let's see the next step. And I'd like to thank the different funding agencies. And behind the 4 components that I have illustrated, there are 4 PhD students funded by the ecosystem that are very proud to work in this direction. Thank you so much.
Thank you so much for your presentation. Any questions from the audience? So maybe I can ask a question connecting to your last point. So what will be the next step towards the clinical applications?
So as it happens in this very complicated platform, it's difficult to have everything integrated together. One thing that, based also on my experience, I think it's really promising, not only for the complete platform, but in general, is the magnetic anchoring and magnetic pulling. Because the possibility for any instrument, also for traditional instrument, having the possibility to operate the instrument from outside by using magnetic field without a direct, let's say, a direct link, without any wires or any connection. This is something that can be useful also for more traditional scenarios. So some spin-off devices, let's say, can be generated quite soon.
And I understand these are all based on permanent magnets.
Permanent magnet, yes. So no heating issue, no current, permanent magnet. And this is the reason why, in terms of controllability, you have to be quite accurate, because the magnetic field is changing very much with the distance.
Thank you.